Welcome to the DreamWork Summit, where you'll discover a unique variety of DreamWork approaches and ways to open to your inner guidance from leading DreamWork experts, renowned psychology professionals, and inspiring authors. Share this powerful event with your friends and family, and join in our conversation on Facebook at The Shift Network. And now your host, Susan Audrey.
Greetings. We're here with Dr. Kristen LaMarca. Dr. LaMarca is a clinical psychologist specializing in lucid dreaming therapy for a broad range of psychological conditions and sleep disorders, including nightmares and insomnia. She's also a co-facilitator for the intensive programs of the Lucidity Institute, where she's conducted research on maximizing the effect of lucid dream induction techniques. Dr. LaMarca also regularly provides trainings in lucid dreaming to healthcare professionals, researchers, and the wider community. Welcome, Dr. LaMarca. It's so nice to have you here with us today.
Hi, Susan. Thank you for having me.
So tell us how dreams come into play in behavioral sleep therapy.
Dreams come into play in sleep therapy in a number of different ways. I guess I should probably talk a little bit about dreams and lucid dreaming and kind of what that is and how that differs from ordinary non-lucid dreaming first. And maybe we could talk a little bit about the benefits and how that can play a role in mental health and just enhancing waking consciousness. So lucid dreaming, first and foremost, it's the explicit knowledge that you are currently in a dream. And this is an insight that happens during dreaming when you gather an adequate degree of self-reflective thought to directly consider what state of consciousness you're in and remember, here I am dreaming right now. And this recognition of the dream's true nature is so clear and distinct that it crosses the threshold from our baseline mode of normal non-lucid dreaming, which is much more restricted by the beliefs and attitudes of our usual waking conditions. And we don't typically think about our state of consciousness when we're relating with our dream content. So this remembrance of dreaming in real time, it opens new doors to varying levels of emerging consciousness that can have some very advantageous features. In the lucid dream state, it's possible to remember not only that you're sleeping, but that you can direct attention and volition toward cultivating specific experiences in the dream, including experiences that you intended to cultivate prior to going to sleep, or experiences that are more difficult to access in waking reality or non-lucid dreaming states. So by changing your perspective on reality or your mental frame on an experience, this reframing of reality gives you more choices for cultivating experiences that can be quite positive and helpful on levels ranging from the very practical to levels that are applicable to creativity, healing, or personal and spiritual development. There's quite a range of these types of experiences that can help people.
That's a wonderful explanation. And can you give us an example of a person perhaps you've helped in a situation where this type of therapy and using lucid dreaming helped somebody work through maybe insomnia? Actually, I'm sure lots of people would love to know about that.
How lucid dreaming could help insomnia? Certainly. Well, there are a number of techniques related to lucid dreaming that coincide with insomnia treatments. Now, insomnia, when people are unable to sleep, they develop these mental models of associating the experience of wakefulness with something very negative, something very unpleasant. However, in a lucid dreaming practice, wakefulness is actually something that's very conducive to lucidity. So I'm able to teach my clients how they can use the experiences of the night and reframe those experiences as a time where instead of fretting over the fact that they're awake at night and being anxious over the fact that they're going to be tired the next day, they can use that time to practice meditation and intention setting techniques, practice dream journaling, and use the time productively to work on their personal growth, use meditation, practice techniques, for example, inducing wake-initiated lucid dreams, using meditation to directly enter the lucid dream state so they can fall asleep consciously, practice yoga nidra where they are meditating between that state of being awake and being asleep. There are a number of these techniques that sort of coincide with each other. Also, lucid dreaming is a means of helping individuals better manage stress in their lives and work through inner conflicts that tend to keep people awake at night. And so these are also things that can kind of coincide with each other to help people work through their insomnia and better learn how to lucid dream and live their lives in a better way.
Mm-hmm. That's fascinating. Now, for people who feel that they're having a difficult time establishing lucid dreaming, what are some tips that you would share?
Well, there's a number of different techniques and standard practices, and there are some that are a little bit more nuanced. This overlaps with some of the work that I've done with the Lucidity Institute, teaching people how to induce lucid dreams and lucid dream productively. And maybe I could share a little bit about that as far as the retreats and workshops that I've done with Dr. LaMarca and the research that we've conducted. And maybe I could discuss some of the more advanced advice that I might have for some people. So Dr. LaMarca, she's done some pretty exhaustive testing and development to refine his methods for studying and inducing lucid dreaming over several decades. In the last several years, I've been honored to assist with his research, and we've been studying methods for maximizing the efficacy of induction techniques. And we recently published a paper on an integrated induction protocol that tested the effects of an herbal memory enhancer called galantamine on lucid dreaming. So during these workshops, we teach participants how to optimize the mental set and psychophysiological conditions for lucid dreaming using several approaches. So to develop the mental set for lucid dreaming, first off, we teach how to develop a high degree of dream recall, so you have a sense of what to focus your waking mind's intentions on in order to become lucid. Secondly, we teach how to use intention setting strategies to help you to remember how to recognize the dream state in real time. This is done through setting your mind to recognize dream signs, which are the distinguishing characteristics of your dreams that can cue you to remember the true nature of your reality, to remember that you're dreaming while dreaming. So here you train prospective memory techniques to remember to do something at a future point in time, that is to remember to become lucid in your dreams tonight and to know and remember how you will accomplish this. So in order to do this, you have to have an adequate plan that you will implement. And we also teach participants how to implement the mild technique. So this is the mnemonic induction of lucid dreaming. This is a strategy developed by Dr. LaMarca during his dissertation, and it's implemented over the course of the night. And in a basic sense, this is where we teach individuals how to set their intention at bedtime to become lucid over the night and wake up from and recall dreams. And once they awaken from these dreams, they rescript and rehearse their dreams as if they had become lucid in them by choosing a point as if they recognized a dream sign and carried out some sort of predetermined goal. And then prior to returning to sleep, they meditate on their intention to become lucid in their next dream. And then we supplement the mental set for lucid dreaming through a variety of mental and written exercises, meditation, yoga nidra-based techniques and a model for relating with lucid dream content productively, including how to prolong lucid dreaming states and best confront obstacles such as difficulties in prolonging the state of lucidity, waking up too soon, how to deal with nightmares and aversive dream content, and so on. And we also teach how to enhance the psychophysiological conditions for lucidity. So we instruct participants in the timing of their rapid eye movement periods when you're typically dreaming, and also how to enhance their degree of wakefulness mentally and physiologically, how to enhance their recall over the night. We teach a protocol for interrupting sleep after approximately 3 REM periods or so, which cycle at about every 90 minutes for most people. So you would interrupt your sleep for about a 30-minute window of wakefulness after 3 REM periods, and at that time you would focus your mind on lucid dreaming and your intentions to remember your dreaming upon returning to sleep. And we also, in this context, we're also able to we are also able to do an experimental test in the context of doing mild and teaching mental SED and sleep interruption, where we looked at the use of that memory enhancer galantamine to induce lucid dreaming. So at the workshops, we looked at, this was a high interest group of individuals who would have a baseline rate of lucid dreaming at about once every 3 months or so. And after training these groups in the mental set for lucid dreaming, we gave them one of 3 doses of galantamine over 3 nights. So these capsules contained either 8, 4, or 0 milligrams of galantamine. 0 milligrams was the placebo, of course. And compared to the placebo condition, what we found was that the 8 milligram dose of galantamine increased self-reported rates of lucid dreaming by like 9 times, and 4 milligram dose increased it by about 6 times. And this showed us that galantamine had a very powerful effect on one's ability to lucid dream. And we even found that in the placebo condition, these persons were able to increase the rate of lucid dreaming only by applying the mental set for lucidity and practicing sleep interruption compared to their baseline rate. So this means that even though galantamine can substantially increase your chance of lucid dreaming, it's not necessary. So just applying the correct mental set, mild, and sleep interruption, this can also improve your rate of lucid dreaming. And this was indicated in the placebo condition. So these are tools and practices that are able to improve access to the lucid dream state to a wider range of the population than we've ever seen before, and they can be very effective when performed properly.
Mm-hmm. So much that you're doing with dreams and sleep. I wasn't aware any of this was going on. This is really fascinating. I hope that a lot of our listeners are new to it too. I'm sure they are. When you speak of a mental set and a script, I think it would be helpful to sort of walk through and give us an example of a particular condition and how that person walks through this process. I think that would really give us an idea of kind of spelling out how it works.
Here, I got one for you. So I had a recent dream where I was looking in the mirror and my hair kept changing lengths. And I didn't become lucid in it, but I was looking in the mirror and, I didn't understand why my hair kept changing different lengths. So let's say I was practicing mild. So I would be going to bed and I would set my mind to remember that I'm going to become lucid tonight. I'm going to be dreaming about once every 90 minutes or so. And I'm going to wake up from these dreams. I'm going to notice that I woke up, and I'm going to recall my dreams. So then I go to sleep, and then let's say I had this dream. My hair is changing lengths. I didn't become lucid, and I wake up. So I notice that I woke up, and I recall that dream in detail. And then I take a moment to rescript that dream. So I imagine myself back in that dream. I recognize the dream sign that my hair is changing length. So I'm looking in the mirror, I notice my hair changing length, and I say say to myself, that's odd. My hair is changing length. My hair is changing length because this is a dream. This is a dream sign. So perhaps at that moment, I decide to do something that I had been planning to do previously. So maybe I plan to fly around. Maybe I would engage in some sort of meditation or dream yoga practice. And I see myself carrying out that action. And then once I have finished doing that, I take a moment to set my intention that as I fall back asleep, I am going to remember to become lucid in my next dream. And I sort of meditate on this intention to become lucid and then keep this on my mind so it's the last thing that I'm thinking about as I fall asleep. And then I return to sleep, and then hopefully in the next dream or the following REM period after that, I would become lucid in that dream.
Okay. And then once you've built that skill, you can use it for intentions that may be bigger and more important than flying in your dream. Even though that's
certainly
fun.
Certainly.
Wonderful. Wonderful. And so how does lucid dreaming, how does it help those with a mental challenge or mental illness? How is it used in this way?
Right. It has a lot of applications in mental health. Sleep, dreams, and nightmares, they tend to be neglected in psychology practice, despite the fact that sleep and sleeplessness have a pervasive influence in our lives, and things like insomnia are a common transdiagnostic criterion in the world of mental health. And moreover, nightmares are frequently seen in disorders like post-traumatic stress disorder, depression, substance abuse. Nightmares are one of the top risk factors for suicide. Not only does the field of psychology really need to embrace sleep and dreaming, but lucid dreaming therapy specifically, it can assist in expanding upon and focusing current therapeutic practice models. Mental health problems are often accompanied by distorted and skewed models of reality. One of the goals of psychotherapy is to assist patients in understanding these negative views of themselves or others or the world so they can be altered and extend positive change into one's external reality in waking life. Lucid dreaming therapy, it's another tool that aims not only to do this, but to do this more directly and purposefully, and with therapeutic material that can promote a sense of safety, psychological safety, and low fear being one of the most critical factors in facilitating change in therapy. And lucid dreams themselves, they're a forum that have a lot of advantageous features that can help therapists implement therapeutic techniques that are known to work in the waking state. So if you're lucid and you know you are safe, you can explore unconscious conflicts and implement therapeutic techniques that can be very helpful, such as inner child work, for example. Intentional grief work can be done in lucid dreaming states. You can dialogue very directly with archetypal symbols of the self to promote insight, healing, and change. These and more techniques, they can all be directly explored in the lucid dreaming state when defense mechanisms are lower and imaginative and self-healing capacities are increased. Moreover, lucid dreams, they can be a very positive state emotionally. They can be filled with more beauty, wonder, excitement, and this is corroborated by the research. As far as mental health populations, positive emotional states are very much needed in those individuals. And additionally, therapy, unlike therapy tends to be, lucid dreaming is very fun. Treatment adherence, motivation, and dropout rates are a big problem in the field of psychology. It's possible that lucid dreaming can be very reinforcing for a subset of individuals in a way that would improve their engagement in psychological treatments. This is something that I've seen in my own clinical work. So there are a lot of different advantages that lucid dreaming can have in terms of helping people in the realm of mental health and well-being.
This is just fascinating. And, you know, one thing that's interesting, so we're talking about helping us to induce lucid dreaming to help us with our waking life, but don't we need to sleep deeply to get to that point of dreaming? So how do we get ourselves to sleep deeper and get these different, you know, cycles of dreams throughout the night? How do you help people with that part?
Right. You know, there's such a mysteriousness to sleep, but, you know, consciousness, it doesn't completely turn out like a light at night. You know, the mind is still active when we're sleeping, but what are we doing in there, and what are we thinking and experiencing, and how can sleeping with more consciousness and remembrance potentially help us awaken more fully to life? And what I've learned over and over in clinical and my educational work, research, and my personal experience with sleep and dreams is that it's clear that sleep can have this ultimate balancing force in our lives. And if you can get sleep right, let alone lucid dreaming, this can help you get a lot of other things right in your life too. And undoubtedly, if you're able to improve your ability to obtain restful and fully restorative sleep, this would aid in the ability to remember your dreams, remember we are dreaming when dreaming, and benefit from better weaving these worlds with our waking realities. And there are a number of standard practices that can assist with enhancing sleep health, and also some that are more nuanced. A good habit to start with is to make sure you establish a regular sleep-wake schedule, so going to bed at the same time every night and getting up at the same time every day, including weekends. This not only can assist with healthier sleeping, but it can stabilize sleep architecture, your sleep stages, and make that more regulated in a way that assists you in better getting to know the times and conditions in which you will be dreaming, and that can help you with becoming lucid as well. Another important point is related to how artificial light, this sort of wreaks havoc on our circadian rhythms and inhibits our behavioral self-regulatory processes. So to improve sleep, it helps to develop a better flow with the natural rhythms of light and dark. This means getting bright early morning light every day, dimming artificial light in the evenings, and powering down electronics during a 30 to 60-minute window before bed, in which you shut off daytime concerns and wind down with calming activities to best prepare your mind for sleep and dreaming. You know, another thing a lot of people don't realize about proper sleep health is that the bed is kind of a sacred space. Too many people use the bed as a place for waking activities like talking on the phone, using the computer, watching television. This causes an environmental conditioning of our unconscious mind. It causes the mind to be distracted and hyperactive in the wrong kinds of ways. The wrong ways meaning it inhibits deep, restful sleep and does not leave room for honoring the dream state and deeper levels of being. So it's important to establish the bed as a space only for sleep and things like intimacy. So a good rule of thumb is to attempt to limit time awake in bed to never more than about 30 minutes at a time. And I guess if I had one last piece of advice for cultivating higher quality sleep, that would be to recognize the tandem relationship we have between waking and sleeping states. If in the daytime we are overly stressed, distracted, and tend to overthink about the past, worry about the future, or over-evaluate the present, this will be reflected in your ability to get restful sleep and also to lucid dream. So improving things like stress management, having more balanced living, or for example, by developing a mindfulness meditation practice where you learn to restore a balance in your consciousness so it is more focused on observing the present moment as it is without judging it. Not only can you live your life more fully, but this will help you sleep and dream more deeply.
Thank you for that. Thank you. I'm sure many of us need to follow that and look at some of those tips. I'd love, we have a little bit of time left, and I'd love for you to share one, maybe two if we have enough time, a couple of cases that you felt were really successful using the lucidity therapy for a particular behavioral challenge or sleep challenge. Are there one or two that come to mind that you could share with our listeners?
Mm-hmm. Well, I think I would share probably one of my own personal stories. Some of my clinical cases, I wouldn't want to just share on the air, and some of those are a little bit more complex and, would take some time to kind of build the case anyway and disguise. But I could share a story probably from earlier in my training in lucid dreaming, because it's more fully integrated at this point. But this was maybe in my early 20s when I was first learning lucid dreaming, and I was struggling with sleep paralysis and having experiences where there was some sort of ominous figure in the room. So it could have been, some bloody, mangled person in the room, or a monster or intruder. And this is a common experience that a lot of people have when they are working on inducing wake-initiated lucid dreams. So this is a type of lucidity onset where you don't become lucid when a dream is already in progress by recognizing some sort of dream sign. Instead, you become lucid by meditating from the waking state, witnessing consciously yourself falling asleep. And often the body goes through sleep paralysis, and you have the experience where you're dreaming of yourself lying in bed, but you're stuck and you're unable to move. And this is very common, where you have these experiences of these dark figures. So I was struggling with this, and I actually turned to Dr. LaMarca about this, and he helped me to see that these figures represented some sort of aspect of myself, some personified aspect of my life, or maybe my past, or something related to me. And I had a hard time seeing this at the time. It was hard for me to see that. I related with these aspects as if they weren't me. I was kind of aversive to it. I didn't want to look at it like that. But I took what he said into account, and I said, okay, maybe I'll consider it. And so the next time this happened, I became lucid. I had another wild. I was lying in bed, and I saw a beast-like figure, an animal, some sort of mythic creature, next to my bed. And it seemed very angry. He was breathing very heavily, and I was terrified. I couldn't move, and I remembered what he said. And he mentioned to me that I could try to talk to it, or I could try a Buddhist-type technique called Tonglen. This is a modified technique where you breathe in a negative emotion that you're feeling, and you breathe out the opposite. So if you're suffering or you feel fear, you breathe in fear and you breathe out the opposite, fearlessness or courage, for example. If you feel anger, you breathe in anger and you breathe out compassion. So I wasn't able to speak to this figure because I was paralyzed, and I was also terrified. So I tried the Tonglen technique and breathed in my fear, and I breathed out fearlessness. And this had a very calming effect immediately on me, and I was able to think more clearly and come to a better decision, where I realized that I could just speak to it mentally. I didn't need to speak because it's a dream, and certainly it could understand me if I just projected my thoughts to this figure. So I decided that I could just say hi to it and introduce myself and say that I was sorry it was angry. I expressed compassion. I said that I was there for it if it wanted to talk. And then what was truly amazing was that it began to wag its tail. So it became friendly. And as soon as that happened, I became unstuck, unfrozen. I was no longer paralyzed. And I was able to get out of the bed, and I knelt down in front of it and I hugged it, and it disappeared into my heart. And so it was this beautiful symbol of integration. And this is a common experience when you have these sort of dreams that reflect that level of integration of these disparate parts of the self. You get this imagery that reflects integration of these rejected pieces and acceptance of these parts of yourself into yourself. And you don't even have to specifically know what it means in order to have these experiences. So this is just a really powerful example. I've had a few other dreams that also reflect these sort of features, and it's something that I think a lot of these dream practices that I aim to teach clients or other people that I work with, these are the kinds of experiences that I aim to teach, and I think are really fulfilling to people and can move people along a personal growth path that can be really fulfilling and helpful in a lot of different ways.
Thank you so much for sharing that beautiful story. That's just wonderful, the transition you were able to make. And I noticed that in the beginning that one of the first things that helped was understanding. To look at, somebody helped you to look at it in another way so that you could go back into the dream. Is that correct?
Exactly. That's what lucidity really teaches. It's another frame or perspective on reality. If you're not able to shift your perspective, then you stay stuck. You're restricted in your choices and your ability to relate with reality, and you're not really able to make the progress that you need to and have the experiences that you want.
Mm-hmm. Yeah, so this is really very important work, and we're coming towards the end of our time together, and I'm wondering if you can share with our listeners how they can find out more about you and lucidity therapy and lucid dreaming.
Mm-hmm. I do have a website. It's mindfulluciddreaming.com. I share a lot of information there and blog posts. I also have a group forming currently to participate in a 6-week online workshop called Mindful Lucid Dreaming. This is an interactive group that will have access to materials, live webinars, and a coaching and community platform designed to increase how frequently you access the lucid dream state, build mastery, and improve confidence to self-direct your continued growth as a lucid dreamer. It's a program that teaches techniques backed by the science of lucid dreaming, and it's also one of the few online trainings that offers a dual emphasis on learning mindfulness meditation and lucid dreaming, since mindfulness and meditation and lucid dreaming, they're very correlated with each other. So this is a chance to optimize your ability to be familiar with your mind's contents to help you lucid dream much better. And so this is a program that starts in January, and you can find more details about it on my website. And if you are a clinical therapist or a scientist physician with an interest in the therapeutic applications of lucid dreaming, I also have developed an online seminar on lucid dreaming therapy, which is approved by the American Psychological Association to provide continuing education credits for licensure. And this can also be found on my website as well. And I think that's all I have on that for now. And, I really just want to say thank you for having me. It was an honor to be able to talk to such a group of conscious-minded people, and just really happy to have been able to have this opportunity today.
Thank you, Dr. LaMarca, and thank you so much. This was wonderful. You brought a whole new avenue of information that we haven't touched on, and I know it'll be greatly appreciated. And thank you to our listeners today as well.
Yes, thank you so much.
Thank you for joining us for the DreamWorks Summit, brought to you by the Shift Network. You can add every teaching and transcript to your personal library by visiting thedreamworksummit.com/upgrade. To learn more about awakening to your full potential and together co-creating a world that works for all, visit theshiftnetwork.com. Thank you again for joining us and for sharing this life-changing information with your friends and family.